So welcome. We're here today for what is going to be a briefer talk than we're used to, which I think is awesome. Being concise is not my strong suit, so I appreciate this a lot. We're here to talk about how Examine Plus can help nutritionists with their practice specifically. And I know a lot of you have had questions about this platform, so I'm excited that we get to do this today. Today, you can see on screen with me, I'm joined by Dr. Peter Woznik. He is a naturopathic doctor, and he's going to be addressing today how you'll not only benefit your clients, but also find it easier to generate content for talks, articles, newsletters, and social media using Examine Plus. For those of you who aren't familiar with the platform, Examine is the largest database of nutrition and supplement research on the internet. They were founded in early 2011, and Examine's mission is to analyze the full body of evidence in order to help people be healthier. So Dr. Peter Woznik, that's here with us today, he has a Master's of Science from the University of Waterloo. I was just telling him in my neck of the woods. And he also has a 4-year Doctor of Naturopathy degree from the Canadian College of Naturopathic Medicine. He has over 5 years of private practice as a naturopathic doctor, and he's a member of the Canadian Association of Naturopathic Doctors. In practice, he has a focus on body composition, digestive issues, and fatigue. And as a researcher, he aims to fight the good fight against the plethora of health misinformation in the world. And then outside of work, he can be found lifting barbells, cooking, working with his hands, gaming, and spending time with his 2 little ones. So welcome, Peter. Thank you for being here. For those of you who are here live, today's talk is going to be a little different structure than typical. So it's a shorter time frame, and also you're welcome to post questions as we go. If you know we're looking at a certain part of the Examine platform and you have a question about that, pop it into the Q&A right away, and I'll be able to interject and we can get your question asked right away while we're looking at that part of the platform. So feel free to put those things up as we go. If there's leftover questions at the end, of course, we can always circle back around, but you're welcome to post those up while Dr. Woznik is speaking. So from there, I'll really turn it over to you and let you get started with what you have to share today.
Perfect. Thank you so much, Veronica. I appreciate it. Welcome, everyone. My name is Dr. Peter Woznik, as Veronica was saying, and I'm very excited to present to you folks today. As Veronica was saying, I want to keep it really interactive. If you have any questions at any point, please just throw them in the chat. Veronica will do her best to nudge me that there's a question. And I try to keep it really hands-on. We'll just be going through the Examine website today in the most practical sense. And I'll be trying to show you folks how useful it can be in practice. So let me flip over here, share my screen, and we will walk through the website together. All right, excellent. I just want to make sure everyone can see that okay.
Looks great.
Awesome, perfect. So here we are on the website, nutrition and supplement information that you can trust. I want to explain firstly how Examine was funded, why it was founded rather, and then talk about our funding, what makes us a little bit different, and then hop into the website itself and really get into the search bar functionality and just how to use the website. So firstly, our story, how we started. This is our founder, Saul. He was traveling and doing some hiking. He wanted to hike up a mountain in Argentina, I think it was. However, he found himself woefully physically inadequate for the task. So thus began a weight loss journey of over 60 pounds. And along the way, he encountered lots of health misinformation out there in the world. So that was a big part of the reason behind the founding for Examine. Another reason is he was also an avid an avid Reddit user, and he was a big part of the fitness Reddit. And about once a day, he would see and or answer the question, should I take creatine, kind of thing. So he kind of got tired of seeing that, answering that. So kind of collectively with those two things, thus began Examine.com. The big thing that makes us different is that we accept no funding from industry of any kind. We don't accept any funding from supplement companies. None of the folks who work at Examine, such as myself, take any kind of funding from supplements or anything like that. We don't sell any supplements on the website because we want to remain conflict of interest free, unbiased. We want to be the source of trusted health information for nutrition and for health topics. And we believe a very important part of that is to communicate to people. We're not trying to sell you anything. We're trying to give you what we think, what we hope to be great information. And if you like and enjoy that information enough, and if you want to pay for the membership, a small fee per month for access to that, for access to the latest and greatest health information, then great. And that's how we receive 100% of our funding. So that is a little bit about what makes us different. So if you remember nothing else from today, just remember you can come to the Examine, punch in basically whatever you want to learn about in the nutrition and supplement information world, and it will usually come up for you. I thought we'd start off today by punching in berberine. Berberine is a commonly asked about supplement in regards to blood sugar and diabetes. So I thought this would be a good way to tour the website a little bit. So when we punch in berberine here, we see a quick blurb, a TLDR, if you will, on what is berberine. So berberine is a plant alkaloid with a long history of use. Its seemingly potent ability to reduce blood sugar rivals that of some anti-diabetic drugs. So that is the super quick. If you just have 5 seconds, or if you want to just get super quick background information, that is it. Also over here we have who wrote the article, their qualifications. You can click through to this, by the way, to see all of our staff and all of their qualifications, ranging from registered dietitians to PhDs in various fields to practitioners as well. So that is who wrote it. Also over here we have the, once again, kind of super quick research snapshot. So you can see some of the volume of research that we do. So for example, on this page alone, there are 312 references, and it covers about 2,000 participants in 7 trials. And that some of the outcomes, some of the best outcomes, some of the B level for glucose. That is more quick information. If you scroll down, you can get into the frequently asked questions. So what is berberine? What are some of the roots in terms of different forms of medicine? What are some of the effects, right? So in addition to glycemic control, blood lipids, liver function, anthropometric parameters, i.e. weight loss, weight gain, that kind of thing. More on the main benefits in particular. And then importantly, we also cover drawbacks. So what are the potential drawbacks in people? For example, with berberine, it does frequently cause some gastrointestinal side effects. So for example, that is something to look out for. How does it work exactly? Mainly for practitioners, but also for some extra keen patients or clients rather. What is berberine also known as? And then some dosage information. So what we're doing here is we've gone through all the available evidence by whatever date is listed here in the top corner. And we have done our very best to, synthesize all the dosing information, look at the highest quality evidence in terms of meta-analyses, systematic reviews, higher level research, but also trying to grade that research in terms of selecting the better meta-analyses with the better trials, and trying to report on the most efficacious dose.
So if I can actually jump in, sorry, on that point about the different research, Diane's asking, what if she just wanted to see the human trials of berberine? Is there a way to filter the evidence that you've used?
Yes. So when we're scrolling down to our content here, which is coming in 1 minute, we are generally we're only listing trials that have human evidence. So sometimes there will be trials that have human and also animal evidence, but generally speaking, in order for us to have the trial in there, it has to have at least some human participants, and obviously that will be reflected in the grade, which again we'll come to in a super quick minute, in the grade of evidence as well. But great question. Just to finish off the dosing stuff, in regards to this, this is a guideline. This is based on the research, and you know, a practitioner always has to abide by the regulatory body in terms of if they can recommend supplements or not. Usually for nutritionists, Examine tends to be more of a source of information for a nutritionist's clients. And one thing I'll show when we scroll down in a minute is you can hop straight to the studies in question, and easily access them and print them out. Print them out a one pager on each study, where that client can then take that information, to their medical doctor or whoever their healthcare provider is, or at very least just for them to get more educated on the subject, and then they can make the educated decision themselves, kind of thing. And then whenever possible, we try to list some some common side effects, as I was saying earlier, some common gastrointestinal side effects. So that is typical of berberine. So in regards to specific studies, specific outcomes, looking at human data, this is the first big stop on our journey, the Examine database. So how things are structured on the website is we have health conditions. So a health condition might be, for example, type 2 diabetes. Health outcome might be specifically what we're trying to improve. So we're trying to improve, of course, blood sugar. We're trying to improve hemoglobin A1C. So the outcomes of concern. So then what we've done is we have done our best to grade the evidence. So we're looking at the level of hierarchy of evidence. Is it a systematic review, meta-analysis, randomized controlled trial, or is it an observational trial that isn't as rigorous as, for example, an RCT? Again, we are trying to only look at human data whenever possible. It kind of depends on the body of research for a particular ingredient like berberine. So generally, with an ingredient like this, generally there is some better evidence out there, some higher quality stuff, which mostly pertains to humans. So in regards to the grade of evidence, we're combining several things in here. And by the way, you can hover your mouse, over each and over the grade here to receive more information. But generally speaking, it's based on the hierarchy of evidence and the quality of that particular paper. So what, did it have a low risk of bias, high risk of bias? Was there were there conflicting interests in terms of supplement company funding for the research? That can and does happen very often. What was a very small trial with very few participants? What was it a huge trial? Was it particularly well run or not? So all those things go into the grade, and then over here we have the effect size. So we essentially grade things at effect size for mild, moderate, or severe. And in this case, generally speaking, there is great or B level evidence, so good level evidence for a large decrease for blood sugar in type 2 diabetes and berberine. So if we want more details, no problem. We can click through to the two studies in particular that we're referring to. And whenever possible, we have done a summary of these two studies here. If you want more information, that's great. You can click through to study details, and we've done a summary of the study by itself. So lots of pre-digestion, lots of information here for people where they can quickly gain access to what we think are good summaries. You can also scroll down to see the most relevant details, how many participants were there in the trial, how long was it, so on and so forth. And lastly, if you want to go to that trial where we can easily click through to that, we're taken straight to PubMed. This would be a good example of something, if we're talking to a client and talking about berberine, the blood sugar is uncontrolled. They're not doing particularly well with dietary interventions, and we think that they should consider berberine with their medical doctor or naturopathic doctor, let's say, depending on where they are. Then this would be a great example of, we can hop to the study here. We can easily print out this page for them. We can give that to the client, or we can send them PDF, whatever it is, and then they can absorb that information themselves. They can take that to their healthcare provider. So this is a great way to share the grassroots, the ground floor information with people, so that they can make their own informed decisions. So that is that side of things. So let's jump back to berberine. Let's look at a little bit at the other health outcomes and the other conditions. So for example, in type 2 diabetes, we're also going to consider related outcome markers, like, for example, cholesterol, triglycerides, insulin, HDL, LDL. And we can see that, for example, there's some evidence for improving each of these markers, but it does tend to be much less in magnitude, much less in size of effect. So it's still there, but the best results tend to be for blood sugar itself, even for HbA1c over the past 3 months, blood sugar, and some notable improvements in cholesterol, total cholesterol, but for example, not as large improvements or decreases in, let's say, for example, LDL. We also have a lot of other conditions here. There is some overlap just because of the difficulty of grouping things by, dyslipidemia or high cholesterol. So there is some overlap here, but it's easy to minimize conditions as well. And we can take a look at, for example, NAFLD, non-alcoholic fatty liver disease, very common condition and complaint. And we can look at the evidence for this. Again, some overlap in markers as well, but we can, for example, look at triglycerides and see improvements there. Whenever possible, we try to comment on even better outcomes, like, for example, liver fat as seen on ultrasound or imaging, but just in particular to berberine, we don't have that outcome listed there. And then we list things in decreasing order of the amount of evidence. So essentially, there's the most evidence for, well, type 2 diabetes and decreasing blood sugar. But if we continue to minimize these, we can see that we have a lot of other conditions here in general. So we have canker sores, we have things from heart failure, metabolic syndrome overall. So a client or patient or a practitioner can come into this easily to update themselves on the latest research for example, berberine. The research feed pertains more to study summaries, which we'll go over in a minute. But just while we're here, this is really the would you like even more information section. So we, whenever possible, provide information on the pharmacology of a supplement, so the absorption, distribution, elimination. We go more into the mechanisms of action, and then we cover the supplement as it pertains to different fields. So for example, there's interest in longevity and life extension for berberine and metformin. So we discussed that a little bit. Neurology. We go over each field as it applies. So there's lots here, so I'm going to kind of quickly scroll through this. But I did want to show that at the end, we do have some information on a little bit on nutrient interactions, a little bit on safety and toxicology, So again, examining the most common reasons, to look at berberine for safety data. So we can go through that and see that at the end. So that is berberine in kind of a quick nutshell.
Can I jump in with another quick question?
Yeah, and just before you do, I wanted to ask if there's any other supplements that you folks would be interested in quickly looking at together. I'm happy to punch them in, but yeah, we can absolutely do a question first for sure.
So Connie's asking, is the information based on single ingredients, or does Examine have information on supplements that would have combinations? For example, NAC and glycine together and the benefits of that.
Right. So whenever possible, we're trying to look at individual trials for whichever supplement. Just because when we're looking at, we're trying to avoid trials where there's combinations of supplements, just because then it becomes so difficult to figure out, is X causing Y, or are the effects from NAC or are they from glycine? So that is kind of the big answer, but also something in the supplement guides we'll look at a little bit is we do cover some information on which supplements would probably go well together. So I'm not sure if we have a respiration guide off the top of my head, but when we go through that section, I'm happy to speak to that a little bit more.
Okay, wonderful. And you had asked for some other supplements to look at. I feel like NAC would actually be a good one, since it's been a little on and off in Canada recently. It might be good to look at some of the safety and stuff on that one. Sounds great.
So our search bar is pretty good. You can usually punch in anything NAC, or you can punch in the acronym itself, N-acetylcysteine. And so here we are. So we can see, that this page was last updated toward the end of last year. And, again, we have the blurb on that is typically used for a lot of lung and respiration related things, though it has great, in general, antioxidant and anti-inflammatory properties. We can see, again, a little bit more information on the main benefits. We try also, whenever possible, to link to our other pages. So, for example, if you wanted to know a little bit more about cystic fibrosis, you could click through to our cystic fibrosis page, and then you can take a look at all the things, all the other things for cystic fibrosis. So, for example, in addition, here we also have creatine. We also have the probiotic Lactobacillus reuteri, in addition for cystic fibrosis, besides NAC. So continuing down, potential drawbacks. So for example, they're talking a little bit about IVs here, probably a case report. Yeah, so there we go. One case of an overdose in an IV, but that doesn't tend to be as common. Can cause red blood cell lysis at high doses. So some perturbations to a complete blood count panel potentially. How does it work? Essentially as an antioxidant or anti-inflammatory. What else is it known as? And the database. So for the database, the condition with the most evidence we're seeing here is COPD. B-level evidence for a slight detriment to COPD symptoms. So that would be a little bit counterintuitive. And if we want to learn more, we could click through to the individual studies here. So we see in the overall summary here, N-acetylcysteine may reduce some symptoms of COPD by acting as a mucolytic agent and reducing sputum formation, but it does not appear to be effective at aiding the lungs themselves or reducing disease progression. So that's a good example of how even looking at our super quick overall bar of saying slight detriment, that's a great example of how, well, it's not really the whole picture. It might benefit some mucus and sputum a little bit, but doesn't appear overall to be helpful with disease progression. And of course, we can click through to the individual studies if we want to. Let's look at this study summary in particular for this one trial. So for example, supplementation with 600 milligrams of NAC and persons undergoing exacerbation of COPD symptoms failed to improve any measure, symptom, or lung function more than placebo. So that is just a good example for that one supplement. The other outcomes examined, so a little bit of research on autism spectrum disorder, specifically the outcome of irritability. And by the way, you can hover over that to see, well, what exactly are we defining as irritability here? B-level evidence, 2 studies, small amount of research here, so not fantastic evidence, but nonetheless a slight improvement or a slight improvement. So I'll linger a second here, just to not get confused with our verbiage here. So even though we're saying downward arrow, that's of course in reference to irritability. So what we're saying is a slight improvement, i.e. decrease in irritability. So sometimes I get questions on that. And then autism symptoms overall, D-level evidence, so not great evidence either way, of no effect for autism symptoms, and so on and so forth. Immune health overall, metabolic health, acne even, marijuana, marijuana addiction, cannabis use disorder, a lot of different outcomes here, but in decreasing order of evidence. So, and that is the research feed, which again we'll go over in a minute. Before we do, I'd love to go back to the main page. As I was mentioning, things are grouped by conditions, so we can go into, for example, type 2 diabetes if we want to. If we want to learn more about the condition itself, or generally more usefully, we can pop over to the examined database. So we can just click through that to just jump down here, and then we can see some of the best interventions for that. So overall, chromium might have the best evidence for type 2 diabetes, showing slight decrease, showing slight changes, or rather improvements to insulin, so on. But also here, we're going to see fish oil with a strong benefit for triglycerides, for example, L-carnitine, so on and so forth. So this is a great way to see some of the other supplements that might be good for example, type 2 diabetes. Awesome. Okay, so holy smokes. So in the interest of time, let me jump over to our other aspects of the membership. My Zoom window is in the way. Okay, so I did mention the supplement guide, so I do want to spend a minute there. So we have supplement guides here. So we do have an allergies and an immunity supplement guide, but we also have others, for example, healthy aging, liver health, joint health, muscle gain and performance, mood, depression, stress, anxiety. So I believe there's 15 or so. So anyway, this is these are the supplement guides. So if we click through to a supplement guide, we can see we've grouped things in order of primary supplements, so the supplements to most consider, secondary supplements, promising supplements, unproven, and inadvisable supplements, so supplements that might cause harm. So essentially, if a practitioner or a patient wants to learn more, they can just navigate straight to the primary supplements, the supplements that we believe have the best evidence for improving said condition. Answering the question earlier of combinations, there are, sometimes as we come across things in research, supplements that keep getting paired together, supplements that might work well together. It's always hard to say. There's generally, gray area, but if we keep coming across something, we'll try to list it here in a supplement guide on combinations of supplements that go well together. I guess in order to fully answer that question, though, we don't review specific supplement products. So you won't ever see that on our website. That is in order to stay unbiased about the research, because we just try to review ingredients themselves rather than getting into, product X or Y is better than this or that or the other. And then people say, well, well, you guys are, biased, you like that product or something like that. So that's why we don't go over that. And before we get into questions, I'd love to go over study summaries briefly. So study summaries are a huge value add of Examine, in my humble opinion, because they help practitioners and patients potentially to stay up to date on the latest and greatest in a particular category of health. So for example, if you have an autoimmune disease, or if you have cancer, or if you have cardiovascular disease, you can sign up. So we can go customize over here, and you can select which categories you want to receive study summary updates on. So for example, I'm interested in categories X or Y, but not A or B, and you can sign up accordingly. Let's go over some of the latest and greatest here. So for example, June 21st, yesterday, in fact, because, sorry, quick side note, we publish these as much as we can in real time, constantly each day. So it's very up to date, and all the studies we're linking to have been published in the last 3 months. So anyway, we can check out, for example, legumes and longevity. Is legume intake tied to higher mortality risk? Once again, if you want just the quick and dirty, you can take a look at the blurb here, or the summary. So in this meta-analysis cohort studies, we try to comment on what kind of studies we're seeing. A higher legume intake was associated with a decreased risk of mortality from all-cause and stroke. The protective effect of a higher legume intake on all-cause mortality was stronger in men than in women. So we'll try and also comment on some of the subgroup analyses, some of the other lesser findings as well. If you're interested in receiving more information on that, you can click through. Again, that was the quick summary that I just read. You can read essentially the who, what, where, when, why. So what was studied, who was studied. So it was 1 million adults who were healthy, who didn't have any apparent health conditions. How was it studied? What were the results themselves? And then, is there anything else I need to know? So this would be, were there any important notes about the study that either the average person might not come across, or for whatever reason, something we picked up on when we were going through this study? So for example, in this study summary, so the findings from this meta-analysis should be interpreted with caution, given that the research judged the quality of evidence as low to moderate. So as such, the quality of the included studies led to substantial heterogeneity, i.e. the differences between study methodologies. So one study, it was impossible to compare apples to apples. The studies were very different. So anyway, leading the authors to meta-analyze studies that were too different from each other to be sensibly combined. So it was difficult for researchers to mash all these studies together, and studies can be very different. However, they found, so for example, all-cause mortality was lower by 6%, and stroke was lower by 9%. But there were no associations for cancer, coronary heart disease, and cardiovascular mortality. So that's kind of just a quick example of a study summary. Over my time, but happy to do any other questions that you guys have now that had a look at the site. I'm happy to hop back to anything we were looking at earlier, or if it's something new, that's totally great too.
Yeah, there was another question that came in.
Great.
Do you have much information on supplements and breast cancer? So maybe you can just even show some of the ways that you might like search or filter.
Sure. So in regards to study summaries, as I was saying, there's the cancer overall category, but probably better, easier way would be just to go to our breast cancer page. So again, generally speaking, you can punch in most things here on the search bar, and generally speaking, it will get you there. So you can just punch in breast cancer. So breast cancer is the second most common cancer in women after skin cancer. It is most treatable when caught early, so on and so forth. And so we can just click through to the Examine database. So for example, there is some research for black cohosh. It's not fantastic quality research. Did show a slight improvement to menopausal symptoms, but a better example one perhaps would be things that increase or decrease risk of cancers. So, for example, we know on a diet basis, generally dairy might decrease colon cancer risk a bit, and red meat might increase the risk a bit. So this is kind of a bit of a corollary where vitamin D has been studied for a lot of different cancers, and generally, or at least in these two larger studies, there was a slight improvement to breast cancer risk with vitamin D supplementation. You're not generally going to find, X or Y supplements helped with the cancer after, a person was diagnosed. Generally, it'll be reducing risk of things, though frequently, we write many study summaries, for example, on how X or Y supplement helped with fatigue from cancer or from the treatment modalities happening with the cancer, like chemotherapy or radiation. So that would be kind of a thing to attempt to focus on here in the outcomes, or for example, anxiety symptoms with having cancer. Certainly that would be a valuable thing for a person to consider. For example, meditation if they had breast cancer. So I hope that helps to answer that.
It's great. I don't see any other questions having been sent in. I think you did a great job showing the whole database. So I'll give just one more second, just in case anyone is feverishly typing. But I do want to share too, for those who are on live, or if you've gotten this far in the replay, yourself and Saul at Examine, you've offered a discount for Networking Nutritionist members. So we'll have a specific link that you can use to access that discount that'll go up with the replay. So if you are interested in using this platform, make sure that you go in, you grab that link and follow it, because it gives a significant discount on the monthly membership cost. So that'll work out to just $15 a month for access to all of this. So very, very valuable. All right. I don't see any other questions. So I think you did a good job giving everyone that overview.
I appreciate everyone's time joining us currently and if watching the replay as well. It's been my pleasure. I'm happy to answer any questions by email after. You can reach out to Veronica for my email address. I'm happy to interact one-on-one.
Wonderful. Thanks again. Thank you all for being here live. And thanks, Peter, for sharing this information.
Thanks so much, everyone. Take care.